The International Obesity Federation says obesity is on the rise globally and efforts to address it are challenging due to misconceptions about the problem. In a report released on World Obesity Day, the organization revealed that 51% of the world's population will be overweight or obese by 2035. CGTN's Nick Mudimba has more.
A global study estimates that if prevention, treatment and support isn't given a priority, more than half of the people in the world will be overweight or obese in 12 years. According to the World Obesity Federation's World Obesity Atlas 2023, if prevention and treatment strategies do not advance, the yearly economic cost of people being overweight and obesity in general will reach $4.32 trillion by 2035. This is comparable to the impact of COVID-19 in 2020 at roughly 3% of the global GDP. Lower-income countries have seen obesity levels increase rapidly. Of the 10 countries with the greatest expected increases in obesity globally, 9 are from low or lower-middle-income countries. All are from either Asia or Africa. Childhood obesity is rising particularly fast. Rates are expected to double among boys by 2035 to 208 million and to increase by 125% among girls to 175 million. In all, over 1.5 billion adults and nearly 400 million children will be living with obesity in 12 years' time unless significant action is taken. The World Obesity Federation is calling on governments to develop national action plans and to build on the framework for tackling obesity. Developed by a panel of global obesity experts in 2020, the framework, dubbed Roots Framework, involves recognizing the root causes, monitoring obesity data, investing in obesity prevention, ensuring access to treatments, and adopting a systems-based approach. Nick Mudimba, CGTN.
Well, earlier we spoke to Johanna Ralston, who is the CEO of the World Obesity Federation, on some of the causes for rising obesity cases in Africa and how to overcome the challenge. Let's listen in.
It's a shift of diet. So there's certainly much more ultra-processed foods, cheap foods that are easily available. People living more in cities and having, more access to cheap ultra-processed foods, less access to fresh, healthier foods. Changes in work and transportation and how people live, meaning they work more sedentary jobs, even at all strata of economic equations. And then it's also there's some interesting cultural ways that have encouraged a larger child, for example, to be seen as a healthier child, or a larger body, which to be seen associated with wealth and success and in some places. And so all of those things are kind of coming together to drive this, but mostly it's that there's been a transformation in our food system over the last 30 or 40 years. A lot of it connected to subsidies and to industrialized food that have meant food was cheaper, which is good, but it turns out that cheaper food is not good for us and is helping to grow the obesity epidemic. And then maternal health also plays a very significant factor. We need to, of course, have healthier, fresher, more affordable and accessible food and opportunities for safe physical activity. But also, we need to see obesity understood as a health condition or a disease in its own right, as well as a driver of other diseases. That means we need to see much more of it in primary care. So what can be done on the individual level is absolutely committing to healthier foods, which is very hard because the default in so many places, the cheaper, easier brand or option is going to be packaged unhealthier food. But really, the more we can see a transformation and at least a deliberate effort for healthier foods, for more physical activity, but also for speaking to healthcare providers and saying, weight is a concern here, will you help me?